Hello, ladies and gentlemen. Welcome to the Medical Spanish Fast Track Roadmap for nurses and physicians interested in learning Spanish for various purposes, including increasing their market value. I'm Vala Jakije, and I'll be your guide throughout this linguistic journey. Well, who is this video for? This video is for CNA, licensed vocational nurses, licensed professional nurses, registered nurses, nurse practitioners, physicians, pharmacists, paramedical, medical assistants, administrative assistants. Anybody who is in healthcare will benefit from this video. This video is about how to make more money as a nurse or if you are other healthcare professional like physician, pharmacist, how to make more money. So there are many pathways. I'm going to talk about three. Right here, we have Spanish proficiency, which is one pathway. If you add a high demand skill to what you have now, it's another pathway. But there are also other pathways, including travel nurse, intercity travel nurse, out of town travel nurse, all those are another pathway as well. But this video specifically focuses on how to learn or improve your Spanish so as you can increase your market value. So specifically, this is for nurses, physicians, and other patient-facing medical professionals. By learning Spanish, different workforce professionals, healthcare workforce professionals can increase their market value. If you are a doctor, if you are a nurse, if you are a pharmacist, whoever you are in the healthcare field, learning Spanish will benefit you if you are in the US or UK or other countries where being bilingual Spanish has an advantage. Okay, you learn Spanish, but there are many reasons people learn a language. So you can learn Spanish for non-monetary reason. You are not learning it just for the money. Even professionally, when you speak Spanish, even if your workplace does not increase your pay, there are other advantages, like you have cultural competence, more cultural competence, you are more culturally aware than other colleagues. You have workplace responsiveness, okay, you are more flexible with the patient. If you happen to have a patient who speaks Spanish, you will be helpful to your workplace. Also, since you are in a healthcare business, it's also part of social responsibility to understand what your patient is saying. If your patient is a minority patient, but Spanish, there are a lot of Spanish speakers, a lot of Latino patients in America. So being able to respond to their need is, I think, also part of social responsibility. If you have the time to learn, it's good to learn it and add to your skill set. Now, you may have other reasons to learn. Maybe you want to hang out with a friend who speaks Spanish, and other thing socially, you want to go to, Spanish dance classes and all those kinds of things. It's a valid reason for you to learn Spanish. Okay. Now, as to monetary reason, if you are a CNA or LVN or a registered nurse, your hourly raise could be from $5 to $10. Your pay may increase from $5 to $10. It's not everywhere, but some places, Texas, Illinois, Florida, New York, California. If you are a bilingual nurse, there are some hospital or some healthcare institution that increase your pay because of the fact that you are bilingual. In some places, if you are a medical doctor, your raise may be up to $20. So that's monetary reason. If you are a nurse and you have a family, you don't always want to work overtime. By learning Spanish, you may be able to get a higher pay without having to work 60 or 70 hours a week. So that's a good avenue to explore. So in this roadmap, you will learn how to become a bilingual Spanish using a fast track. Okay, and when I say bilingual Spanish, I means you are focusing on something specific and you learn that thoroughly. I'm not talking about learning medical vocabulary here and there about all the fields that exist in the medical field. You are never going to be proficient by trying to cover everything. You have to focus. A little bit of grammar, a little bit of grammar, and you learn to build sentences, and after that you focus on a specific subfield. Okay, you cannot cover a big field. You take years to cover that. So you look at a field, a subfield that's very practical, and you focus on that related to your field of specialization. You focus on that and master that. Develop ability to write, to listen, and to speak in that specific subfield. That's how you can become bilingual. You are never going to be bilingual by covering everything. Okay. So this is a context of interaction where a caretaker is taking care of a patient. If the patient is speaking Spanish, and interpreters are not available all the time, and language line may not give you somebody who is really proficient in the field or subfield you are covering as a healthcare professional. So it's to your advantage to learn Spanish if you have a Spanish speaking patient that visit your healthcare institutions. This is another context of interaction. Okay, and this is another context of interaction. In all these contexts, if you speak Spanish, it will benefit you. If you are bilingual or professional, it will benefit you should you be facing a Spanish-speaking patient. Yeah, so Module 1, Module 2 are part of Spanish grammar, and the Step 3 is medical content. And this here, if you take a screenshot, any subfield you want to convert, you follow this approach. But in my program, if you take the program, you will learn the linguistics techniques and approaches that are used. They are well resourced, that are used to teach the specific content I'm going to teach in the program. So, but it's applicable when you learn those techniques and approaches, you can take them to convert other things on your own when you have the time to. Okay, so at this level, if you want to check the program, don't go to the description below the video, click on the link, and then it will take you directly to the program. Okay. Well, so far, if you've been enjoying the video, if you have learned anything, consider subscribing to the channel, and consider like the video and share its content with your friend, and whether they are in medical field or not. If they need to learn Spanish, you can share with them. Thank you. So the subject matter we are going to cover in in this program, in the program I'm teaching, is vital sign measurement. But whoever you are, if you are, you are a urologist, or you are a respiratory therapist, or you are a cardiologist, or you are, OBGYN, whichever area you are specializing as a nurse or as a physician, once you take this program, the linguistic approaches and technique you will have learned in the program will help you convert any other micro skill of your choosing. So this is a template in a way for you to convert. You have a skill, you are a cardiologist, and you want to convert your skills to be able to take care of your patient. Well, approaches and techniques will be taught to you in the program. The content of the program will not be cardiology or gynecology or nephrology, but it will help you convert, and it will give you sources where you can find material in Spanish directly and gather and do both print, online, and audio visual materials that are out there. You'll have access to, you have the sources, and you have material, you have audio material directly presented by native Spanish speakers, and that will speed up your learning process. So the program Bilingual Spanish Nurse, as I said, it has the grammar component and it has the medical content component. So all this will be covered, from temperature to heart rate to blood pressure to pain to oxygen level, all those, respiration, and all those will be covered. And there is a course on vital sign measurement in Spanish. The course, I have the course separate from the program. The course only handles the vital sign measurement part of the program. If you want the course, if your Spanish is already good, you are already making sentences in Spanish, you don't need any help, you can go and take that course directly. That will teach you how to measure vital sign in Spanish. But if you are beginner of Spanish, or your Spanish is a little rusty and you want to brush up and all those with the grammar, then you take the program. They are the same price, because I don't want people who don't have the grammatical knowledge to be at a disadvantage. So it's the same price for both courses. So if you are interested in the program, in the course, you can take the course. You go to the description of the video, you'll find the course. You'll find the course by itself. But also you'll find the link to the program. The program will include grammar and also a bonus that gives you some interpersonal skills about provider-patient interaction. So separate from the course, then there is the program. This is the program. It's the same thing as far as the content is concerned, the subject matter is concerned, but this includes the grammar part and the bonus for interpersonal communication skill development. So this is the bonus. You have essential Spanish for provider-patient social interaction, introduction to Spanish cognate for medical professionals, Spanish pronunciation basics. So this module also will help you, will strengthen will make you whole as far as linguistically speaking. The course standalone does not include the bonus. It doesn't include the grammar. It's just the module on vital sign measurement, reading and the vocabulary, and then speaking, listening and speaking. But the program has both module on grammar, part of speech, sentence building, and also it has this bonus module. Okay, but I put them at the same price, so somebody who buy the program will have everything they need. But somebody who already speaks Spanish and who want to learn vital sign measurement very fast, they can just get the course. I put them at the same price. You check if the course is on sale, buy it. If it is not on sale, buy it, because it will. You are not only buying the program, you are buying the linguistics approaches and technique that you can use to convert other micro skill from English into Spanish. So this is the outcome of the program. You'll be, if you are facing a Spanish speaking patient, you'll be talking to them, you'll be listening to them, you'll be talking to them. If you want to take a brief note, you'll be able to take a brief note. So that's the advantage of the program, different from the course by itself. But if your Spanish is already good, you can buy the course and be comfortable. But if you still need grammar, or you need some interactional skills, then buy the program. It's the same price. You don't lose anything. On that note, I thank you very much for your time, and I wish you the best of lucks in your endeavor to improve your Spanish skills. Check the program out. It might help you have a greater impact as a healthcare professional. Thank you for your time.